Hello, I'm Sandeep Goyal. I'm one of the physicians who specializes in heart rhythm disorders at Piedmont Heart Institute. In this video, I would be discussing atrial fibrillation as it pertains to stroke risk reduction. I'll attempt to answer a few of the common questions that patients usually have, including why do strokes happen in atrial fibrillation? Does everyone have the same stroke risk who has atrial fibrillation? And what can we do to reduce the risk of strokes in atrial fibrillation? We will discuss medical and procedural options. So before we go into atrial fibrillation related strokes, I wanted to speak a little bit about stroke mechanism. Strokes happen because of the damage to the brain tissue. And there are two common mechanisms. But 87% of the strokes happen because of blockage in the brain arteries. And most of those blockages actually are clots that travel from the heart or large blood vessels and get lodged into the brain artery. There's a small number of the strokes happen because there's a plaque that ruptures inside the brain artery. So atrial fibrillation is particularly interesting from that standpoint. The first image you will see is actually a normally beating heart. And there you can see on this CT scan that the heart has a coordinated action, and there is this cauliflower looking structure that is actually the left atrial appendage, which normally contracts quite well. In patients with atrial fibrillation, there is a reduction in the atrial contractility, which is our top chamber, and the top chambers are beating chaotically, which leads to pooling of the blood, especially in this little pouch called left atrial appendage. When the blood pools, it tends to form clots because normally blood is always moving. And this is why atrial fibrillation has increased risk of stroke. These clots that form inside the heart can break off and go to the brain. And they can go to other organs and cause other thromboembolic events also. So the question always comes, does everyone with AFib have same risk of stroke? The answer to that is no. How do we define the risk of stroke? So we use this very well validated score called CHADS-VASc score. Because a patient's stroke risk in atrial fibrillation depends on several other factors. Some of the more important ones are age, especially patients who are over 65 have higher risk of stroke. Once you go to 75, your stroke risk is even higher. Patients who have other comorbidities such as diabetes, hypertension, weak heart function, such as congestive heart failure, will have higher risk of strokes. Patients who have had prior strokes are certainly at a higher risk of stroke. And women tend to have a slightly higher risk of stroke in atrial fibrillation. So we use this point system and try to quantify risk. And as you can see, the risk continues to go up from 0 to 9, which is the maximum amount of points you can get in this system. And the risk could go up to as much as 10% in a year. So who needs treatment to reduce the stroke risk? Based on that point system, if you have 0 points, that means you're younger than 65 and you have no comorbidities and you've never had a stroke, you actually don't need a long-term blood thinner. However, if you have more than 2 points, which could be from any combination of those risk factors, it is pretty clear that you will benefit from long-term blood thinning medications for most patients. And the patients who have a score of 1 are much more complex, where we need to individualize the decision making. So what can we do to reduce the risk of stroke? One of the common things that we often use is use of medications that are also known as blood thinners. These are technical term is anticoagulant. There are 2 major types of these drugs. There are newer drugs that are actually not that new because they've been around for about 12-13 years, called direct oral anticoagulants. The common ones are apixaban and rivaroxaban. They're also known as Eliquis and Xarelto, as you may have better recognized them by their trade names. And then there is a common drug that was used for a long time. It's warfarin or Coumadin, and it is a separate class of drug. But all of them will reduce the blood's ability to clot, hence leading to reduction in the stroke risk. However, there are no free lunches, so they come with increased risk of bleeding. How do we assess the risk of bleeding? So we use another score, it's called Hedge-Bled score, that has several components that allows us to predict an individual's risk of bleeding while taking blood thinners. And this again will include things like uncontrolled high blood pressure, abnormal liver or kidney function, older patients, anybody over 65, patients who are taking other medications such as an aspirin or clopidogrel, or, NSAIDs like Advil are at higher risk. And, in this score, if you get a point score of more than 3, then you are considered at a higher risk of bleeding. This does not mean you can't take blood thinners, but we have to be more careful. Now, what about for patients who have bleeding on blood thinners or are extremely high risk of bleeding? There are procedural options that do exist. The procedural options focus on left atrial appendage itself, as most of the stroke risk is derived from the left atrial appendage. There are two kinds of ways to deal with the left atrial appendage. There are non-surgical catheter-based procedures where we would go from a vein in the groin and do the procedure. And that could include Watchman Flex Pro device. There's a device called Amulet device. And then there's a suture-based ligation called Lariat device. As far as the true surgical options are concerned, where a cardiac surgeon will perform the procedure, they would include AtriClip, which is commonly done when patients are undergoing open heart surgery for other regions, and a suture ligation during the open heart surgery. So all of these provide local therapy to the left atrial appendage and do not increase the risk of bleeding. However, they come with some of the procedural risks. The goal of stroke prevention in atrial fibrillation involves assessing a patient's bleeding risk, assessing their stroke risk, and then really taking patient's preference into account to come up with a plan that suits best for that patient. And sometimes it would involve consideration of surgical and catheter-based options for treatment of atrial fibrillation. If you or a loved one has atrial fibrillation, Piedmont Heart has locations throughout the state of Georgia. If you have any further questions, please give us a call or check out us online at our website.